My name is Maulik Gandhi. People can call me Mal for short. I'm an orthopedic consultant. I specialize in the shoulder and elbow and some conditions of the hand. I also have formal positions in teaching and education and innovation. I am the lead for my trust in the technical skills lab and also the clinical lead for innovation. I became a doctor because of a experience I had in my teenage years. My grandfather became very unwell and he was given uh, only a few days to live. And I remember at that time feeling quite shaken up and quite upset. But the dedication of the healthcare team did see him through on that occasion. And I remember them working very hard, the compassion and just looking after him. And I realized at that time that was something which I wanted to do going forward. And that was my decision on becoming a doctor. So when I was at medical school, I actually wanted to be a cardiologist, and I actually did an extra degree, a BSc, to help me along that path. But when I went to my clinical years and actually went into surgery, that's when I realized, wow, this surgery is amazing. Going in, seeing some fantastic operations, seeing anatomy and pathology come to life, and then having the intellectual mix of the subject as well as doing things with your hands really was the perfect blend for me. So that's when I realized that I wanted to become a surgeon. And then after I decided that I want to be a surgeon, I started exploring the different subspecialties. And I remember one of my bosses at the time questioning me that, do I really want to be a surgeon? Because it does impact family life and home life. And, you're not going to get home on time. You're going to lose arguments at home because you're just unreliable. And he goes, the one thing that I would advise is, make sure that you're comfortable that when you go to sleep, having lost another argument, that it was worth it. And I remember replying that and saying, actually, you know what? At the end of the day, no matter how late I've come home, I've always found that orthopedics for me was worth it. And then deciding on shoulder elbow, I decided on that because there's a wide variety of pathology and I can do keyhole and open surgery. And that really does interest me. And going forward, I think there's a lot of innovation and new technology coming into keyhole surgery. And again, I'm very interested in innovation and technology enhanced healthcare. I think the most rewarding thing is joining the patient on their journey. So they come to me often in pain or having worse function or being anxious about what the diagnosis is and going on that journey from working out what's wrong with them, finding out what is it that they want to gain back, and actually doing that with them. So it might be surgery, sometimes it's not surgery, but hearing about how it's made a difference to them. So I find that the most rewarding part of my job. One of the most recurring themes I get when I receive feedback is that patients like that I give them time. They liked that I'm approachable. They say that I've explained things in a way that they've understood, be it verbally or draw out diagrams for them or redirect them to resources. They feel that they are empowered to make the right decision for them. And sometimes it does involve more time or bringing in family or friends to understand, is this the right thing for them? But giving them that time to make the decision, which is the right one for them, is what I think they appreciate the most. I feel really privileged that patients actually give me the chance to be part of their story. No two patients are the same. They come maybe with the same type of problem, but it affects them in different ways. And when you hear about how it affects them in their job or in their sports or in their home life, it's amazing what you hear back. And sometimes you come across jobs that you never even knew existed. But just knowing how it affects them and understanding what they want to achieve. So, for example, an elite sports person might have different objectives to an older patient who may just want to be out of pain from the activities they were doing last year. So, knowing what they want to achieve and then hearing what they have achieved after you've actually been on that journey with them. I really do enjoy hearing that and being on the journey with them. I see every patient as a brother or sister, as a mother or father, or as a child of another person's family. And just like how I would want the best for my family, I would try and give my best to the patient in front of me. And really, by adopting that mindset and adopting that principle, that becomes the compass for my care.